We're talking about knee pain today, one of the most common concerns that people have, whether you are an athlete, a weekend warrior, or simply just trying to stay active. But what is really causing it and how can we fix it? My name is Adam, proud father, married to an amazing woman, fitness enthusiast, registered physical therapist. This channel is dedicated to those busy parents trying to figure out how to perform at their best in this crazy game of life. Before we talk about the 5 reasons why your knees might be hurting you and also how to address these 5 causes, it's important to talk about the kinetic chain. Basically, we are made up of a chain of joints, and we have both mobile and stable joints. A mobile joint moves in many directions and has a greater range of motion, whereas a more stable joint really moves in basically one direction. For example, in the leg, we have the hip, knee, and ankle. The hip has multiple degrees of freedom and a wide range of motion. The knee, on the other hand, is really just a hinge. It bends and it straightens. So when we get unwanted movement in the knee, such as rotation or side bend, over time, that causes wear and tear, strain, and potential injury, often leading to pain. So reason number 1 is a lack of good hip mobility. If we have a sedentary job where we are not moving much and we're not getting that movement through the hip, often our hips can become very stiff. We can have a lack of hip mobility from stiffness in the joint or the surrounding tissues, and also a lack of control and coordination of movement, which we call motor control or stability. So first, we need to figure out, is it a tissue restriction problem or is it a stability and motor control problem? So if we assess the movement of our hip, as seen here in this video, we have flexion, moving the knee towards the chest. We have extension, moving the leg behind the body. Abduction, moving the leg away from the midline. Adduction, adduction, moving it across the midline. We also have external rotation and internal rotation. Once we have figured out what is the reason for this lack of mobility, we can intervene with different exercise and movement strategies to help restore that mobility so that your knee doesn't get stressed and strained in different directions when performing physical endeavors. Second, hip stability. So with a joint that is mobile, we now need to have good control over that joint using the muscles. So if we wanted to do something like jump, cut, run, different things that require stability of the hip, if we don't have that hip stability, then our leg will wobble and move in directions we don't want. And on a fixated foot, this can cause stress through the knee. Number 3, quad and hamstring weakness. The quads and the hamstrings control the knee in that front to back direction. Our quads, the muscles at the front of the thigh, actually have to activate as they elongate when we descend stairs. So if you're having issues coming down the stairs, it could be that your quads are weak. When we slow down after a sprint, often we have to use our hamstrings to slow us down. And that's another example of needing those muscles to be strong in order to support your knee. So what do? We do simple exercises, wall sits, sit to stand, body weight squats, lunges, hamstring curls. We can gradually build up the strength of these muscles using these exercises to support the knee. Number 4, just like the hip, we have ankle mobility. The ankle is very important as that is also what we call a mobile joint. The ankle will plantar flex, pointing the toe down, pointing to the toe up, dorsiflexion, pronation, and supination, or inversion and eversion. If our ankles don't have adequate movement, once again, the knee might take up some of that movement and compensate. We do not want this to happen. Is this a motor control issue, or is it a joint and tissue stiffness problem? Once we figure out what it is, we can address it through stretching, dynamic mobility exercises, or just improving the movement and the coordination. Number 5, ankle stability. Just like the hip, I'm sure you're seeing a theme here. The ankle needs to be stable. The foot often needs to be stable when planted in order to generate force through the body and not stressing the knee. So the muscles that stabilize and keep the foot stable and in neutral need to be strong. So we can do this with simple standing balance exercises. Put a foam pad under your feet just to get a little extra balance work. We can do heel raises or single leg heel raises, not holding on to anything. Then we can move to more dynamic movements like bounding and plyometrics, all while making sure that our foot and ankle is stable. Now, we also have a bonus, loading tolerance to the knee. For the longest time, we told people not to have your knees travel past your toes. This actually decreases the loading tolerance, which potentially decreases the threshold for pain. So what we need to do is back out and slowly build up the tolerance to meet the physical demand that you're presenting to your knee. Now you have 6 potential causes. Assess that, figure out if you have these issues, and try to correct them. Once those are sorted out, then we can determine if your problem is truly a mechanical issue. If you have adequate hip mobility, hip stability, quad and hamstring strength, ankle mobility, ankle stability, and you've built up the loading tolerance, then your issue might be coming from something else, which means you could have poor recovery, not good quality of sleep, maybe you're not eating enough protein, not enough calories, you're not hydrating properly, or maybe you have too many traumatic incidences that occurred at your knee, and now you have to work through it from a more psychological perspective. All of these are valid reasons, and we need to look at it from a holistic perspective. So if you like this content, hit the like button and subscribe, because I've got more videos coming at you. If there's anybody in your family and friend circle that could benefit from this content, please share.